So I wanted to talk in particular to people who are having a baby for the first time. You would have heard all sorts of stories because everyone has, a different experience of pregnancy and of delivery. I want to say to you, don't be scared. It is possible to deliver very safely. The most important thing is that you educate yourself as much as possible. Get to know your team that's looking after you. Get to know the center where you're going to be looked after. The things to look out for during pregnancy that you need to be aware about. So if your baby isn't kicking properly, as per normal, if you are you're having bleeding vaginally, those are things that you need to report. If your legs are becoming swollen, if you have any symptoms out of the ordinary, these are things that the midwife who is connected to you or your birthing team need to know about, and they can advise you accordingly. Now, to the delivery date itself, I want to say to you, there is no reason for you to be in pain to deliver. Being in pain and during labor does not make you more of a mother or a better mother than if you have an epidural for delivery. It is perfectly safe to have an epidural. In my role as an anesthesiologist, it is something I do pretty much, most days for women who are in labor or who are having a cesarean delivery. It is very safe for you to have this, and it should take away the pain of labor. And if you are having a planned cesarean delivery, we'll typically do what we call a spinal anesthetic if you haven't had an epidural in the room already. And again, this is very safe because it allows you to be awake, takes away the pain of the surgical incision and the surgical procedure. But if you are in pain at any point, even after either a spinal or an epidural has been done, please tell your anesthetist and your medical team looking after you that you are feeling pain. We do not want you to have a painful, traumatic experience to delivery. As much as possible, we want you to have a pleasant experience so that when you think back to the birthing of your baby, you don't think back to it with negative emotions. We don't want you having PTSD from that. Okay, so I want to say to you, stay engaged, stay safe, and enjoy the pregnancy. Okay. All right. Well, I hope you've learned something and I've given you some food for thought. And yeah. All right. Bye-bye for now.